procedure that we've been carrying out this afternoon is a targeted cryoablation procedure of the prostate in a gentleman aged 78 from Woking near here. If it's a small gland, prostate gland, and they do vary, it can take an hour and a quarter, but if it's larger it can take up to 3 hours. Targeted cryoablation of the prostate is a procedure we carry out for prostate cancer in men who've had radiotherapy in the past, who unfortunately have been shown to have recurrence of their disease. And we use it as a minimally invasive operation to destroy the cancer. It's carried out under anaesthetic using small needles, so it's pinhole rather than keyhole surgery. It's performed under an ultrasound device to monitor the prostate, and during the procedure we freeze the gland using argon gas through the needles, which freezes the tissue of the prostate to minus 100 degrees centigrade. We then thaw the gland using another gas, helium, which warms it up, and we also protect various areas around the gland to prevent damage using small temperature needles, and the whole system is computerized. And the reason why we do this is to try and help men have a further treatment for their prostate cancer and avoid the use of what are called hormones, which are used very often in this situation, and these have their own side effects and their own costs. So it's a one-off procedure to try and avoid that.
What's the success rate of this kind of operation?
Well, remembering that these are men who've already had radiotherapy, it's around 70%, and that is a 70% chance of getting a special blood test called PSA, which monitors the cancer, down to normal levels at 3 months. So around 2/3 of men are helped by this procedure and 1/3 are not.
And what's the average cost of an operation of this kind?
It's around £8,000, which is expensive, but patients are only in hospital usually one night. We've even done it occasionally as a day case, so we save money on beds, as it were. But the main cost is the equipment, the disposable equipment, which is all thrown away at the end of the procedure. So it's quite costly from that point of view. But it has to be weighed up with the fact that hormone treatment costs about £2,000 a year, and so over a few years of hormone treatment it all balances out.